Those who have diabetes or know someone who does often find that the first few hours after getting up can provide valuable insight. The body has the ability to send out certain early warning indicators that indicate that there is anything wrong with your blood sugar. It is not uncommon for a few subtle symptoms to manifest themselves first thing in the morning. Getting a head start on these warning signals may have a significant impact on both your day and your health. As a result, let's take a look at 7 potentially hazardous indicators of diabetes that you should be aware of. Number 4 may surprise you. Number 1. Blurred vision. It's possible that your eyesight is a bit blurry when you wake up, and it's not simply because you're still tired from the previous night's sleep. When you have high blood sugar, the lenses in your eyes might enlarge, which can make it difficult for you to see properly. This swelling is a consequence of having an excessive amount of glucose in your blood, which causes fluid to be drawn into the lenses and so causes your vision to become hazy. Despite the fact that this sensation can occur at any moment throughout the day, it is typically more obvious after a night in which blood sugar levels were not under control. It's possible that the swelling in your eyes will be more noticeable in the morning if your glucose levels were too high while you were sleeping. This is your body's method of prompting you to check the levels of glucose in your blood. If you have blurry vision, it is a warning indication that your blood sugar may be out of balance. Thus, you should not disregard it. In addition, there are actions that you may take to safeguard your vision and stop any more harm from occurring. If you are a smoker, you should quit since smoking can cause even more damage to your blood vessels, including the blood vessels in your eyes, which can make your vision difficulties much more severe. When you go outside, you should also be sure to wear sunglasses so that you can shield your eyes from the sun's UV radiation. Those who have diabetes are more likely to develop cataracts, which is a frequent consequence of the disease. Exposure to these rays can hasten the growth of cataracts. Taking these preventative measures can assist you in protecting your eyesight and avoiding additional difficulties. Number 2. Tingling or numbness. Dementia neuropathy, also known as nerve damage brought on by high blood sugar, is characterized by this typical symptom. Beginning in the hands and feet, neuropathy is a condition that affects the nerves that are responsible for transmitting impulses between the brain, spinal cord, and the rest of the body. Some of the symptoms that can be caused by injury to these nerves include tingling, numbness, and even pain. It is possible to experience tingling or numbness at any time. However, it is typically more obvious when you wake up after sleeping motionless for the entirety of the night. The nerves that have been injured may be more prone to become active, which may cause you to have that uneasy sensation in your hands or feet. If neuropathy is not treated, it can result in major problems, such as a loss of sensation in the extremities, which makes it difficult to detect injuries or infections due to the lack of sensation. At its most severe, it can result in ulcers, infections, and even amputation of the affected site. It is imperative that you get medical attention right away if you routinely encounter this discomfort in the morning. Number 3. Morning nausea. It is possible that you are experiencing diabetic ketoacidosis, DKA, if you wake up feeling queasy or as if something did not feel quite right in your stomach. In diabetic ketoacidosis, DKA, the body begins to break down fat for energy instead of glucose since it is unable to get enough glucose into the cells because it is lacking insulin. Kines are acids that can accumulate in your blood and cause you to feel unwell. Ketones are produced as a result of this process. If a person's blood sugar remains out of control for an extended period of time, diabetic ketoacidosis, DKA, can occur in persons with type 2 diabetes as well. However, it is more prevalent in people with type 1 diabetes. If this problem is not addressed, it can result in symptoms such as nausea, vomiting, disorientation, and even coma. It is a significant complication. It is important to take immediate action and seek the advice of a medical expert if you are starting to experience nausea on a regular basis. Number 4. Morning headaches. There are a few reasons why people with diabetes could have a pounding in their head when they wake up. This is something that no one enjoys seeing or hearing. To begin, if your blood sugar went too low throughout the night, it is possible that your brain experienced a shortage of glucose, which would result in a headache. In contrast, if your blood sugar levels rose over the night, you can wake up with a pounding headache. This is because your blood sugar levels surged overnight. The presence of a headache upon waking up is an indication that your blood sugar levels may have been unstable while you were sleeping. Your body is trying to alert you that there is something wrong with the way you are controlling your glucose levels by giving you headaches in the morning. In addition to taking measures to control your blood sugar levels, there are further actions that you may do to protect yourself from experiencing headaches. Maintaining proper hydration is essential since headaches are frequently brought on by dehydration. Therefore, it is essential that you drink sufficient amounts of water throughout the day. A constant sleep schedule and avoiding excessive amounts of coffee or alcohol, both of which can disturb your sleep cycle and lead to headaches, are two of the best ways to ensure that you get regular, restful sleep. Stress can contribute to both swings in blood sugar and headaches. Thus, proper management of stress levels is also very important. Before going to bed, practice some simple stress management strategies such as deep breathing, meditation, or mild exercise. These approaches can help you relax and lessen the risk that you will wake up in pain or discomfort. Number 5. Morning fatigue. However, despite the fact that you have just gotten a full night's sleep, you are still feeling fatigued. What exactly is going on? Your body has a difficult time converting sugar into energy when it is at an excessively high level in the blood. Consequently, rather than waking up feeling revitalized and prepared to begin the day, you can have the sensation that you have recently completed a marathon while you were sleeping. In the event that you consistently wake up feeling exhausted, this is a strong indication that your diabetes may require more effective management. Not only can this exhaustion occur in the morning, but it can also last throughout the day, leaving you feeling exhausted and unable to keep up with the tasks of everyday life. Make it a point to keep a careful eye on your blood sugar levels and make any necessary adjustments to your diabetes management strategy if this becomes a persistent issue. Number 6. Morning hyperglycemia. Just try to imagine yourself waking up feeling sleepy, thirsty, maybe perhaps a little bit queasy. It is possible that you believe it is simply the result of a poor night's sleep. Nevertheless, for those who have diabetes, this may be indicative of something more serious. Your body is reacting to the normal rush of chemicals such as cortisol and adrenaline, which is what is happening right now. These hormones instruct your liver to increase the amount of glucose that is pumped into your circulation in order to get you ready for the day. Although this is not a significant issue for the majority of individuals, if you have diabetes, the additional glucose in your blood might cause your blood sugar level to soar. If your diabetes is not well managed or if your medication wears off overnight, this hormone spike can be more obvious. It normally occurs in the early morning hours and can be more noticeable if your diabetes is not well managed. This glucose rush can impact you throughout the day, making it more difficult to maintain a consistent level of blood sugar. Although it is known as the dawn phenomenon because it is most evident in the morning, it continues to be a problem throughout the day. Checking your blood sugar levels first thing in the morning is a good way to remain on top of this situation. If necessary, you should also discuss the possibility of modifying your insulin or medicine with your healthcare practitioner. To assist you maintain more consistent levels of blood sugar throughout the night, here is a helpful piece of advice. Before going to bed, consume a healthy snack that contains both protein and fiber. Number 7. Dry mouth and excessive thirst. It is possible that you will wake up feeling as though you have just traversed a desert and are in dire need of a glass of water. However, this is not your regular thirst in the morning. Rather, it may be an indication that your blood sugar levels were very high the previous night. When your glucose levels are out of control, your body makes a concerted effort to eliminate the extra sugar by the removal of it through urine. Consequently, this results in the need to urinate often, which can even cause you to get up during the night to use the restroom, a condition that is referred to as nocturia. Because they have to get up numerous times during the night to pee, many people who have diabetes experience sleep disturbances as a result of their condition. In spite of the fact that you are making an effort to relax, your kidneys are working extremely hard to eliminate the excess glucose. This ongoing process can lead to dehydration, which is the reason why you wake up feeling that you have an overwhelming want to drink water. In the event that you find yourself waking up with a strong need to drink water, this is most likely an indication that your blood sugar levels were elevated overnight. When this occurs, it is essential to monitor your blood sugar levels and maintain a healthy amount of hydration. Although it may appear that these symptoms are little or simple to dismiss, they may actually be significant markers that your diabetes is not being controlled as well as it should be. In the morning, your body is in the process of resetting itself for the day, and if it is sending out these signals, it is requesting that you pay attention to it. However, it is essential to keep in mind that these 7 symptoms are not exclusive to the morning. Rather, they can manifest themselves at any time of the day, depending on the degree to which diabetes is being controlled, the levels of blood sugar, and other individual characteristics. However, it is possible that some of these symptoms will be more obvious or more frequent in the morning due to specific situations that take place throughout the night. These conditions include the dawn phenomenon and hormonal changes that have an effect on blood sugar. Did you find this video useful? If so, don't forget to hit the like button and subscribe to our channel. By subscribing, you'll stay updated with more informative and valuable content like this. We're dedicated to helping you maintain a healthy lifestyle, and we truly appreciate your support. Thanks for watching.